Doctors of Reddit, what is the most mind-blowing recovery you've ever witnessed? Resident here. When I was a medical student on a cardiology rotation, we had a very nice 40 years old lady that was being treated for a heart attack, kinda young. But okay, this type of heart attack, deemed an NSTEMI, is the type where she did not have to be urgently rushed to the cath lab. So she had hers the morning after she was admitted, seemingly fine before going down. While in the cath lab, she spontaneously went into cardiac arrest. They got her back after 2 shocks, multiple rounds of CPR, and a round of EP. Usually, if someone is coding for a while, it doesn't look good for them. But she came back and was intubated, so it's more of a watch and wait deal after. Well, overnight, she self-extubated herself. When I rounded on her in the morning, she was awake and said she felt fine. Her only complaint was that she felt like she got burned on her chest, and that was irritating her a bit. Oh yay, that was the 200 J of electricity going through you a few hours ago. She then went on asking when she was going to be discharged because she needed to go home and take care of her 2 dogs. The fact that she went into cardiac arrest in-house and in a shockable rhythm definitely helped her chances of a good outcome. But it's still one of my cooler stories. BC, contrary to what people see in the TV shows, people don't just wake up, eager to take on the day, after cardiac arrest. I had a guy like that. He rolled in with an NSTEMI and coded in the trauma room, was quickly coded and actually woke up asking the trauma nurse to stop compressions. I cared for him the next day after his angiogram and he told me that story. I hadn't before realized just how much he scared the crap out of the trauma nurse. Resident here. This one is more of a mind-blowing remission than an acute recovery. Had one patient in one of my internal medicine rotations in medical school who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage IV endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Have seen a lot of remarkable recoveries back to baseline from people unconscious and intubated in ICU, especially in young people who have high physiological reserve to bounce back from catastrophic events, for example, thyroid storm, aneurysms, ketoacidosis. I'd say the most surprising recovery was in a drug and alcohol patient. Man in his 20s with a very difficult upbringing. Dropped out of high school at 15 and was just hooked on and alcohol since. Very expensive habits, so he'd commit crimes to fund the drugs. Get out of prison and back to us for rehabilitation. Commit another crime. A horrible cycle. He wasn't motivated to recover because he didn't have much of a life to return to. Serious health problems from drug use. Nobody would hire him due to his criminal record. Parents in prison. Also seemed mildly intellectually impaired, possibly from chronic drug use. He only had his girlfriend. Then his girlfriend died of a drug overdose. I thought he'd follow after because he was hanging on just for her, but he did a total 180. Booked himself into detox. Attended all his appointments. Got his high school equivalency. Stayed clean for years and got hired as a security guard. On discharge, he was with a new partner and they had a baby on the way. During his last appointment he dropped into the dollar store and had a bag with a stuffed elephant and pink blanket inside. Just wow. That's some will right there. Not a doctor but a nurse who worked in long-term care. I had a patient who was apparently actively dying. She had stopped eating for 3-4 days and was on comfort measures only. This meant she was receiving morphine every hour and the rest of her medications were discontinued, and she was only being fed and given water as tolerated. Out of nowhere one day she just sat up and said, "I'm hungry," and like that she was back to normal. She lived for around another year or so after that. Paramedic fireman here. Had a guy, 65ish years old, who dropped dead while on a treadmill. Leads showed asystole, which means dead as heck. Zero electrical activity in his heart. 1 round of CPR with 1 round of ALS meds. Goes into a shockable rhythm. Defibrillate. Shock. 1 time. Guy gets a normal heart rhythm back with a pulse. Loaded him up. Had a 5-minute transport. By the time we got to the hospital, this man was making jokes with us and would have walked in if we let him. This is not how cardiac arrests go. You usually die, and if you live, your quality of life after is usually greatly reduced if not negligible. This was absolutely incredible. As a resident, I admitted a patient for a COPD exacerbation. Pretty routine. What wasn't was her history. She had been discharged from the hospital 4 years before with hospice. She had biopsy-proven small cell lung cancer that had metastasized to other organs. Essentially zero survival, and she had gone home to receive medicine to make her comfortable. She hadn't taken any cancer treatment. 4 years later, when I admitted her, there was no trace of cancer. The only suggestion from the pulmonologist was her crack C habit must have been lethal to the cancer, or her body just found a way to fight it off. Basically, we don't know how, and her odds of doing it should be about 0. Doctors hate her. She cracked the code. Sorry, I am not a doctor, but my brother had been given hours to live 3 times during his battle with cancer. I flew to see him and say goodbye all 3 times, and another 20 odd times to give moral support over the 2 years he fought. One night in the hospital, the doctors told us to say goodbye as he had only hours to live. We all fell asleep holding his hand, and at 6 AM I opened my eyes and listened to see if I could hear breathing. It was quite dark and all I heard was my brother's voice saying, "Holy shit, I am still here." He lived for another year. Holy shit, I am still here is a great quote. I'm a patient, not a doctor. I was diagnosed at 22 with lupus and got acutely sick very quickly, which is a little out of the ordinary for the disease. Long story short, it's almost killed me a few times, but I'm lucky enough to call myself healthy for the time being. I've had a lot of doctors and met a lot of rounding med students since I'm a fun teaching case. Anyway, a couple years ago I was out with my daughter at a park and I ran into the doctor who originally diagnosed me forever ago. I was acutely ill at the time I met him and my prognosis was pretty grim. I hadn't seen him in over 10 years. He hesitantly walked up to me and asked my name and then yelled, "Oh my god, you have a daughter." Honestly, I have never seen a grown man so excited in my life. He was almost giddy. He wanted to know everything about how I had been doing and just kept smiling when I said I was married with kids and had been feeling good for the past few years. It was such a chance run-in, but I'm so glad he got to see me doing well, since he had seen me at my absolute worst. Makes me smile just thinking about it. AWW, that's so cool. It makes me all silly to hear of the doctors getting all cute because they want you to be healthy. Not a doctor, but this is my mom's story from a few years before I was born. She was driving home during a really bad snowstorm. She lost control of her car, swerved into the opposite lane and got T-boned by a pickup truck. The truck hit her car so hard, the driver's portion of the car was pretty much all that was left somewhat intact. My mom sat there lifeless for 30 minutes before anyone even called for help. Rescue had to use the jaws of life to get her out of the wreck and rushed her to the hospital. While in the hospital, doctors told her family that they've done all they can, but all other patients in situations like hers either died or were comatose for the rest of their life, and she probably wasn't going to make it. Soon after that, her blood started to coagulate, and her road to recovery began. She had to learn how to do everything again. Talk, walk, hold her head up, feed herself, clean herself, dress herself, etc. To make a long story short, after a year, I think, she went to the house of the head surgeon who operated on her and introduced herself. The doctor had to excuse himself for a while so he could gather his emotions because he just couldn't believe that my mom made the recovery she did. She doesn't even look like anything happened to her, but since her accident she has lived with a quarter of a lung missing, 1 kidney missing, double vision, and partial loss of feeling on her right side. Other than that, she looks and acts perfectly healthy. 4 years after her accident, she gave birth to me. I think she's a walking miracle and she's the strongest person I know. Dang, this reminds me way too much of my own mother's accident. That kind of hard hit has lasting effects, and I'm dang proud of both your mother and the surgeon for keeping her alive. My mom crashed on black ice and broke 2 many bones and received a TB. Medics thought she was a DOA. 19 years later, and she's still kicking. Not a doctor, but a relative. My grandma ended up in bed for about a year when she was in her mid-70s. She had been declining for a fair while. and just kept getting more and more medication to take care of her different illnesses and discomfort. I went up there 3 months before this and I was sure I wouldn't see her again. She was almost comatose, just lying in her bed, barely being responsive. At one point my 7-year-old second cousin randomly overhears my mom telling my aunt that grandma started on yet another type of medication. Far into double digits. 7-year-olds start crying because apparently she thinks that medicine is making grandma more sick, and every time she gets more pills, she gets more tired. My mom and aunt comfort this poor kid, telling her that it is not the medicine that is making her sick and whatever you tell a 7-year-old to calm them down. My mom is a nurse, or was back then. She is retired now. She worked with her best friend at a smaller private hospital in Denmark, and a week later in the lunchroom she is telling her friend the story about my cousin. The in-house anesthetist picks up on the convo, asks about what type of medication grandma is on. Mom starts mentioning the one she remembers, which really gets this guy's attention. Basically my mom names a chain reaction, like medicine A has lack of energy as a side effect and another side effect, which is then treated with B that causes lack of energy and another side effect that is then treated with C, etc. So basically if grandma didn't get A, she wouldn't need B, C, D or E, and that is just the 5 medicines that my mom remembered off the top of her head. Mom gets a list of all the medicines together for her colleague. Apparently him and his doctor Mrs. went over them as an after dinner activity, and the next morning he had a 3-page letter written up that my mom could give grandma's doctor, arguing why 25 out of 28 medications were at best unnecessary if not harmful. Mum got the next day off, drove 450 kilometers to see grandma's doctor, showed up without an appointment, pulled a Karen, got to see him, showed him the letter, and half an hour later left with a new medicine schedule to step grandma out of 25 different medicines and half the dose of the 3 remainings. 2 days later my grandma got out of bed for no apparent reason for the first time in 6 months. 2 months later she was walking the dog and baking again. 15 years later grandma is still alive. She is missing a leg now, and 4 years ago she moved into a retirement home with my grandpa. I haven't seen her for 3 years, but she is doing good. She ended up getting compensated by the stated, can't remember the figures, but it was the maximum amount. Mind you, not that high in Denmark. For some reason the phrase pulled a Karen is utterly hilarious to me. Glad to hear grandma is doing great. Cardiac care nurse here. Got called to the ER to assist with a cardiac arrest of this patient in his 50s. He had a delay of 10 minutes, no oxygen to his brains for 10 minutes. The EMT already tried reviving him for 45 minutes on a flatline. After 15 minutes the doctor said, last check before we declare this patient deceased, and when we did he actually had a pulse and a decent rhythm on the monitor. Mind you, we use an automatic CPR machine so we don't have to do manual compression, so we had to turn off the machine to check. He got wheeled to the ICU, ended up on the coronary care 2 days later. Pretty confused I might add. And a week later he walked out of the hospital when the doctors discharged him without any brain damage or visual physical damage. Reviving him for 45 minutes on a flatline. Holy crap, they were determined. Good for them. I had a patient during med school, 19-year-old guy who had a history of his aortic valve replaced because he was born with a bit of a funky bicuspid aortic valve. Well, when I saw him in the cardiac floor, he was walking, talking, totally normal except for a bit of weakness on one side, pretty much just on that floor for more monitoring and treatment for a vegetation on one of his valves. Prior to that though, he'd arrested in the field. EMS got called and did CPR for 30 minutes. Got circulation back, took him to the ED where he arrested again. They got him back and took him up to the ICU, intubated on pressors. He woke up, got better, and got transferred to us. One of the ICU attendings that took care of him stopped by and just kind of stared at him and said, "You were dead." I think that was a huge win for him. I was an intern working in the MICU during flu season. An elderly woman came in with respiratory distress due to the flu. She was already in bad shape prior to this, COPD, heart failure, etc. She was subsequently intubated, started on bedside dialysis, went into liver failure, developed an allergy to heparin, to name a few. She was maintained in a medically induced coma for about 2 weeks because she could not be extubated safely. Long story short, after about 6-8 weeks at the hospital, she went to a rehab without needing a trach or dialysis. I'm still surprised how she managed to make it out. I'm a rehab doctor, so this is right up my alley. I saw the guy who was impaled by a 2x4. It literally went through one side of his abdomen and out the other. Somehow, it avoided his internal organs and the surgery team was able to safely remove it. He got discharged to rehab service a few days after admission and we discharged him home a few weeks after that. Basically a normal guy with some residual pain and new scars. Typical, not a doctor. And not mine either. My mom was driving someplace on the highway, and it was winter. She started seeing semi-trucks on the side of the road, having slid off from the ice. By the time she decided enough was enough, it was too late. She hit black ice and slid into the opposite lane, straight into a semi going 60 miles per hour. Rolled down the side of the semi, and somehow ended up with both the cab's landing leg and her van's engine in her lap. The entire back half of her vehicle was sheared off behind the passenger and driver's seats, ended up in the median. The first person there took me into their vehicle to keep warm. I was a year old, saved by the blanket draped over my seat, and she called for the medics. Because of the horrific scene, paramedics assumed she was DOA, so they did code 1 to the scene. The medic strolls up to the driver's side, and my mom says boo. She tells me the practically guy crap his pants, then hurried to set her free. After cutting through the wreckage, they got her to the local hospital, then life flighted her to the bigger one. She had a broken femur, lots of cuts from the glass, broken left arm, 2 or 3 ribs, hip, knee, and ankle, plus internal bleeding that seemed to disappear once they arrived at the hospital. Turns out she received at B, which she still suffers from 19 years later. The most significant part of the recovery, however, was raising a special needs child and a son by herself. My father left her because of the accident, and no one else would help her. She couldn't do physical therapy or even get treatment for hurt B because of it. Spinal orthopedic engineer here. A small set of patients whose disc degenerates to a grade 4 spondylolisthesis in a very fast span of time, such as a trauma case, can become either paralyzed or partially paralyzed in their lower body. A 2-hour surgery involving a spinal interbody and posterior fixation can under most circumstances have a patient walking the same day, although that never happens due to safety precautions such as having them rest a day or two to allow muscle soreness to fade. Had an elderly patient who presented with a severe kidney infection condition called emphysematous pyelonephritis. Normally we would take her to the operating room and perform an emergency nephrectomy or removal of her kidney. However, she was unresponsive and hemodynamically unstable and was deemed too unhealthy to undergo a big surgery. As a last resort, we placed a drain tube into her kidney to give the bacteria a way out. She didn't improve much after this. She was never really alert or had energy to get out of bed. She was eventually discharged to a nursing home on palliative care. A month later, I saw her in clinic, and she was P. She was completely coherent and furious about the nursing home. Apparently one of the other residents was bullying her and ruining a card game she liked to play. We admitted her to the hospital that day and did her nephrectomy. She had one of the fastest recoveries ever seen after a nephrectomy, and she was in her 80s. Incredible recovery from where she started. In a messed up way, that jerk in the crappy nursing home saved her life by gave her motivation to get better. In April of 2014, my husband was diagnosed with ALS at the Mayo in Rochester after what we thought was a simple visit to be tested for knee replacement. We were shocked, as you might imagine. There is no cure for ALS and average life expectancy after diagnosis is 3 years. In July, he retired from his job as a writer-director at a global reinsurance company. As a Christian family, we prayed and we believed he would be healed. Every 3 months he returned to the Mayo for tests to see how the disease was progressing. It never got any worse. In January of 2015, he asked his company if he could return to work because he didn't appear to be on the way to death and we weren't in a place financially for him to retire. They had not been able to replace him and were happy to have him back. In April of 2015, the doctors at the Mayo undiagnosed his ALS. In August of 2015, he had surgery at the Mayo to relieve an impinged nerve in his spinal cord. This sounds much simpler than it actually was. It was hoped that over time this would allow his body to heal and correct the foot drop he was suffering that brought him there in the first place. They said this could take a couple of years as the nerves heal extremely slowly. His feet and ankles were checked by a nurse about 6 hours after surgery and all normal strength had returned. All the doc could say was, "This is very unusual. He is very much alive and still working and has a great story to tell." He calls it his year of living dangerously. This isn't a recovery. He was clearly misdiagnosed. You don't just recover from ALS. It's a death sentence. The only uncertainty is how long the degeneration will take before it kills you. Diabetic with Fournier's gangrene. Do a quick Google image search. Had to be debrided and was basically flayed from mid-thigh to the pubic area, down to the muscle. Surgeon did a stellar job on debridement and the patient, albeit had a very long inpatient stay, had all things considered a pretty incredible recovery. Not doing the Google image search. This is a long comment TLDR. At the end, we had this few hours old newborn transferred into our ward. She had her older sister die at the age of 11 days without any diagnosis. A metabolic disorder was suspected but not proven. We feared that she didn't have much time to live if we didn't diagnose and treat her ASAP. Her mother was traumatized to the point of refusing to name her. She thought that if she lost her without naming her, that it will hurt less. I was a part of the team that took care of this case. I spent a lot of time with both the newborn and her mother. I managed to convince the mother to name her. She gave me a couple of names she had in mind and I chose one. Both of them were the first people I would check on when coming in and the last to see right before going home. Finally, the team managed to diagnose her phenylketonuria deficiency. The treatment was dietary. She had to avoid consuming the phenylalanine amino acid. She got better. A year later she came in for a checkup and a couple of dietary touch-ups. She was the most beautiful 1-year-old girl I have ever seen. I wanted to smother her with kisses and hugs, and I'm someone who's not usually a fan of kids. When I first saw them, her mother looked at her and said, "That's Uncle Sam. He's the one who named you. He played a huge role in saving your life. Give him a big kiss and warm hug." That almost brought me to tears. She was a healthy and energetic little angel. The best part of my medical career so far. P.S. To be totally transparent, the disease she had is kind of common and not a hard diagnosis to find. And the prognostic is a good one, if treated early. One last thing. I played a small role in the medical investigation, but the difference between the day we got her in the ward and a year later is unbelievable. TLDR. A mother refused to name her newborn because she thought she, the newborn, would end up dying. I named her, played some role in taking care of her. A year later she came in for a checkup and she was the healthiest 1-year-old. Frick me, it's got dusty in here all of a sudden, honest. Another not a doctor comment, but a friend of mine was a pretty bad alcoholic with a weak heart. He was 40 years old, tried to quit drinking cold turkey, and his second day without a drink he started having seizures, so his wife took him to the hospital. That night he decided he didn't want to be in the hospital and tried to leave. He was getting violent, so the doctors and nurses sedated him and put him into a medically induced coma. During the coma all of his organs except for his kidneys went into failure. He was being kept alive by machines and medications in the ICU for 3 weeks. Nobody expected him to live. The doctors said he was the sickest person in the hospital and didn't expect him to live, but miracles happen. He slowly started getting better over his stay in the ICU and the doctors did a tracheostomy, breathing tube in his throat, different than a tracheotomy, as a last-ditch effort to take out his feeding and breathing tubes to try to wake him up. It took a week just to wake him up from the coma. After a few more weeks of PT and at least a month in a rehab facility, he is currently fully recovered and getting back to a normal life. From what every single doctor and nurse that worked on him said, that his recovery would be described as mind-blowing. Also, the doctors and nurses at Valley Hospital in Ridgewood, NJ are the best in the world and deserve all the thanks in the world for the work they do every day. TLDR. My alcoholic friend went into organ failure from quitting drinking and recovered after being in a coma for 3 weeks. This does raise a good point as well. If you're an alcoholic quitting drinking, go. Doctor, the withdrawal symptoms from quitting cold turkey are well known to be potentially lethal. Better to get medical advice and do it safely. Doctor, MD, here, I have a patient who is in her 20s who was a micro-preemie born at 24 weeks gestation. That is just at the cusp of viability and can have debilitating consequences or, very commonly, ultimately death as a newborn. She tells me at birth they gave her mother the option of palliative care for her, allowing her to pass naturally, or fighting for her life. Mother chose the latter. Somehow she beat the odds, has no noticeable deficits and got accepted to a prestigious university. I would say that is a pretty good recovery. Not the doctor but the catalyst. My grandmother had a tumor that was apparently unreachable, just behind her ribs. I did not know this, and went to snuggle with her for a while because she was generally just very nice to be around. However, while repositioning myself, I elbowed her in the ribs, right where the tumor was. Now, keep in mind, again, I'm like 9. I don't know anything. All I knew at the time was that I elbowed grandma and she shouted in pain. My mother and grandma both comfort me while I cry over this. A few days later, grandma goes to the doctor again, and it turns out the tumor had been dislodged to the point where they could remove it. She kept kicking for a few more years after this, and I like to think that I helped. A kid who had a 3% chance of survival with surgery and still survived for 2 years and lives to this day. I'm the patient. I went through 10 surgeries in 800 days from 2015 through 2018. Bone spur to amputation. 2 bone biopsies in 3 days. 2 separate ankle fusions. Avascular necrosis and osteomyelitis. 18 inches PICC line for 10 weeks. Then I became an LBK amputee on the 19th of April 2018. Received my first prosthetic on the 18th of June 2018. On the 6th of November 2019 I squatted 607 pounds and leg pressed 1005 pounds. Within a year of being blessed with the ability to walk again I am squatting more than most 2-footed beings. I'm just stoked on it and felt this question was a dope place to put it. Keep crushing the recoveries my medical misfits. Man in his 30s was brought into my intensive care unit having drowned in a lake for roughly 30 minutes before being pulled out by friends and emergency services. His core temperature was 29 Celsius, but the paramedics had managed to restart his heart on the way to the hospital. I wasn't holding out much hope for this guy. 30 minutes underwater usually means either death or permanent brain damage. We put tubes into every orifice and created a few more for good measure. He was hooked up to a ventilator, hemofiltration unit and placed on a warming pad. Over the next 24 hours we slowly warmed him back to normal temperature. Once his vitals were quite stable, we held off on his sedation and slowly woke him up while I was off shift. By the time I was back in 12 hours later, he was sitting up having a cup of tea. I walked past him that morning. He looked at me, and I looked at him. I felt like I'd seen a ghost. When he saw that look on my face he started to cry. One of the few times I've ever hugged a patient. He walked out 2 days later, and 5 days after the incident which by all accounts should have meant his death. I will never forget him. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.